Hi, everyone, and welcome to another episode of Aila Health's Patient Spotlight series on long COVID. I am here today with Patricia Anderson, who is a long COVID warrior. She is an emerging technologies librarian for the health sciences. Her work involves identifying trends relevant to the educational research, clinical, and creative endeavors of the University of Michigan. Her current interests include healthcare and social media, disability advocacy, graphic medicine and digital storytelling, 3D printing, precision medicine, thematic analysis, and systematic reviews. Her personal interests include martial arts, music, poetry, origami, and cooking. Welcome to the spotlight, Patricia.
Thank you, Shannon, for having me here today. Thank you.
So there's really a lot that we can get into today. So I'm so excited for this conversation. But I thought maybe a good place to start would be around your blog. So you have a blog that you've maintained over the months where you share your experience living day to day with long COVID. So will you tell us a little bit about what that journey has been like for you and your health living post COVID?
Sure. Thank you. The blog was originally a lot of my work content, and I track emerging trends and technologies. And when I first came down with COVID, it was March 13th, 2020. And this was before my university closed. And it was the same day that the federal government, put out that they announced that, we needed to be paying attention to COVID-19 as a pandemic, that the big announcement came out the same day. And I had been tracking this since January because as doing emerging technologies, I subscribed to the World Health Organization alerts. And I had been watching this creep closer and closer for several months. So a lot of people were really shocked and surprised when the announcement came out. And there were a lot of really, really scared people. And so when I came down with it, I go, well, I'm pretty sure it's not going to kill me. So let me use this as an opportunity to try to help other people maybe not be quite so scared, and to try to help people learn more about it, because I'd been watching it for a while. So I came down with the symptoms that Friday the 13th.
If you weren't superstitious before, maybe you are now.
Actually, Friday the 13th is, don't distract me, but that's a magical day with a lot of symbolism that is very wonderful and beautiful and powerful. And no, it's not going to make me superstitious. But
so you got sick on the 13th.
I got sick on Friday the 13th, and I think it was 2 days later that I started to blog about it. And it's kind of, when I tell the story, I like to sort of lead into it a little bit and give the context of kind of how it changed my life. So a month before, I was at a martial arts seminar. And a couple weeks before, I was at a hockey game with friends. And I don't own a car, and so I walk everywhere. And 2 days before I came down with COVID, I walked almost 12,000 steps, just chunking along. So there's been a lot of impacts there, but that's to show that I was really active and involved and very I was really alive and strong and doing lots of very active things before. And the first couple weeks, I started out trying to blog every day, and I would post on Facebook, and people would ask me lots of questions. And so then the next day when I'd blog, I'd try to answer some of the questions that I'd gotten the day before. And then I kept getting weaker and I couldn't blog every day. It was just too exhausting. And so I was blogging every other day. And then after a couple of weeks, they said 14 days and you're done, right? And so I said, well, I'm officially over it now, and you may not see blog posts as much. And the real story was that was when I really got so weak that I couldn't blog. And I was just so exhausted. And the way I experienced COVID didn't match what we were being told to expect. The warnings that we had, because it was so early. I mean, it was the second day that I had COVID or was it the third? It may have been the third day that I had COVID when the local COVID triage line opened up. And I was one of the first people to call it because they had me on their list of people, and they phoned me and they said, don't call our clinic anymore. Call this line. Just don't talk to us because we don't know anything. And then I was on hold for hours. But what they told me on the triage line was I couldn't get tested. There just aren't enough tests. And so as long as you quarantine, that counts as good enough. But now at our local long COVID clinic, you can't be a patient unless you had a positive test.
So you had not been positively diagnosed.
Well, that's why in my blog, I called it undiagnosed for a long time, because a lot of people kept saying, she has COVID, she has COVID, she has COVID. And I kept saying, you can't say that because I haven't had an official diagnosis. And so I was trying to be very careful and clear about that when blogging, that mine was a suspected case or a presumptive case, but it wasn't a verified case through PCR testing. And I eventually got a clinical diagnosis after I ended up in the emergency room, which was almost a month later. Yeah, and they had me follow up with my primary care doctor. And at that point, I was thinking that there were so many things that were weird about my experience. I had so many symptoms that matched what we knew and so many that didn't. So when I called the triage line, this is backtracking in the story a little bit, one of the things they told me was to stay home completely unless my fever spiked over 104, right? But
which is a high fever.
Well, that's a high fever, but they're like, you're going to be better off staying home. Everyone was worried about the hospitals being overwhelmed. It was growing rapidly in many places. Michigan was anticipating a lot of trouble early on, and there were a lot of really sad stories. And I know, because I work in the health system, I knew people. I know people who are on the COVID ward now as workers, as nurses, or as doctors. I know people who are on the COVID care planning team for the university. You know, I'm part of the health system, even though I'm not a healthcare provider. I'm a medical librarian, but I'm connected into the system. And that's part of why I want to be really careful in my blog about being accurate and using good quality information and sharing appropriate resources and representing things appropriately.
And for those who are interested in taking a look at your blog, I'll include that link in the description of this video. And so I'm just wondering, Patricia, at what point in your recovery did you start to feel like there's something more that's going on here? You know, like the symptoms just kept hanging around, that you weren't getting better like you thought, or maybe, you know, the physicians maybe thought you would, or even as a world, you know, because this early on in the pandemic was so early that we did not see this long COVID, you know, this post-acute sequelae as something that had really fully emerged. So can you speak to that point in your journey?
So the first 2 weeks actually weren't, they were bad, but they weren't as bad as they were for many other people. And I did not end up in the hospital or even thinking that I should go during the first 2 weeks. And it really got worse for me after that. I was a fool in that I worked full time the whole time I was sick. We were working from home anyway, and I could sit up at the computer and I wasn't exposing anybody. And so I just worked through the whole thing. And I now tell people, rest, 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 rest more than you think you need to rest. Because that seems to make a big difference in the recovery. But so I didn't do that. And by the end of the first 2 weeks, I was really exhausted. And I was really, really bone deep cold all the time. And where other people had fevers, my temperature was like 93. And I could not get warm to save my life. I would work at the computer with 2 or 3 blankets on my lap, and I'd be wearing long johns and leggings and pants over that and fleece boots, and I'd wear my winter coat, and then I'd put blankets and ponchos over that, and I'd wear 2 or 3 winter hats, and this would be indoors at my computer. And I was wearing, I still have them here, I have gloves with cutout fingers so that I could type. And people, I was just like, I looked like I was dressed to be outside in Alaska, you know. And my son, because he'd been exposed to me, his office said he needed to stay home too, of course. So our whole family was being, you know, keeping away from the rest of the world. But then when we were past the quarantine period and he went back to work, that was when I started to realize how bad off I was, because I had been resting and he had been doing everything for me. It was there was the first 2 weeks when I was sick, and then because of we waited another 2 weeks after that for him, because he never developed symptoms. So it was after I'd been sick like 3 weeks or a month, and my son went back to work, and I tried to do a load of laundry on my own. And I walked down into the basement and put a load in the washer and came back upstairs. And then I went down in the basement to put the load in the dryer. And by the time I got back upstairs, I couldn't breathe. And I was struggling so hard to breathe that I ended up calling the triage line again, who put me on the phone with the nurse, who put me on video and watched me trying to breathe, and ended up in the emergency room where they kept me for overnight, ran a gazillion tests and all of that. And that was when I figured out that this wasn't, I was not only not getting better, I was getting worse. But theoretically, I should be past being infectious. And now we go back and we look at my step data on my phone, and they talk about long COVID as a waxing, waning presentation, which means you get better and then you crash, and you think you've gotten better and then you crash, and you keep having this happen. But we can go back at my step data and see this happening the first week and the second week and the third week I was sick. We can see this in my step count data long before I realized what was happening.
So that's so interesting that you have some of this biometric data to be able to look back and see, how you were being affected following the virus. Was that helpful for you in just how to navigate this, new normal, or this ongoing recovery?
Well, we didn't think to look at it until after I've been in neuro rehab for about 8-9 months now, and I'm now switching. That was a telemedicine rehab program, and I'm now switching to an in-person rehab program. And it was at that point that we thought to go back and look at the data. Go, oh my God. And I was just curious. I was like, well, I have all of this data. And I go, gee, I didn't even think about my phone capturing that data. Let me go back and look at it. And everyone's like, wow, you can see that. Because 2 weeks out when I was supposed to be done, I was going, oh, I don't want to have deconditioning. I work in healthcare. I know about deconditioning. I don't want to do this. So I'm going to start trying to walk more. And I would go out for walks, just slow walks to try to keep my body from getting deconditioned. And I would go out and I would walk, 1 mile. And I was used to walking several miles at a time. And 1 mile should not have been a big deal. But I would walk 1 mile. And then I would come back, and the next day I'd walk 90 steps because I would be completely flattened. And those first few weeks, you would see that pattern of me trying.
That waxing and waning.
Well, right. And it was always pushing myself to try to do a little more. And after those first few months, during the first summer afterwards, I realized I needed to try to do less, and I would build up, and I would be walking, to the corner and back. I would walk my dog, through the yard, and I would build up to going around the block once. And then as soon as I walked around the block twice, I would have another big crash. And at that time, I was calling them a relapse. But we didn't know that this wasn't COVID. This was the long COVID, and this was a different thing.
And so there's the physical challenges that go into this, right? Of like, okay, I'm physically working with myself in baby steps to take literally one step at a time, and then having those relapses, like you say, it's physically challenging, but it's also very mentally challenging and emotionally challenging as well. Can you speak to that a little bit? Just how you would navigate, your physical wellness, but then, how are you coping with those relapses?
Um, it's been really interesting because so many people during the pandemic have been talking about the emotional struggles of being alone for a long time. But I am a dyed in the wool introvert. I have learned how to, I'm fine on computer, and I do enough performing and presentations, and I know how to sort of gear myself up and get my game face on and do these things. But deep down, I'm an introvert. And when I had to be working from home and staying home, I realized how exhausting it had been for me on a daily basis just to go into the office every day.
Mm.
And so for me, it was a 6 of one, half a dozen of the other kind of thing, where the staying home was in some ways felt very safe and very relaxing. And my son is just an absolutely delightful person to be around, and I feel very lucky. I think if he hadn't been here to be a caregiver for me, I don't know if I would have survived. But he's also he's really funny and he's really lively. So that's been a real gift. But the relapses, my emotional reaction has been really peculiar, where I would do it and then I would just go, I don't understand. I've been doing everything right. I've been doing this the right way. To avoid deconditioning, you do this. To avoid the crashes, you do this. And I go, I did it. And then I'd crash again. And I go, I don't understand. What did I do wrong? And I kept trying to puzzle it out intellectually. And it kind of built up, but it didn't really hit critical mass until early December. So, I'm pretty resilient, but it did hit. And one of the things that happened was one of the real challenges for me has been showering. For some reason, it hits me like somebody clonked me over the head with a 2x4. And we tried, I could tell because I was keeping data that the showering was triggering bad reactions in my body the day after or the week after. And so I tried doing showering less often. I tried what about the showering was triggering. I tried sitting down. I bought a shower stool. I tried, maybe it was the fragrance in the shampoo. I tried different shampoos. Maybe it was, I tried special kinds of showering brushes for your hair. I went to chronic fatigue MECFS support groups and got a list over a page long, single spaced, of things different people had tried to make showering work better for them. I tried dry shampoos. I tried everything anybody could think of.
Mm.
And none of it worked. I kept crashing. And each time I showered, the crashes got worse. And December 5th, it all hit, where I showered and washed my hair and felt fine. And then the next day, I was so weak, I couldn't lift my legs or arms. I couldn't hold my phone. my son had to lift my head for me to take a drink, I was totally flattened. And I was crying because I didn't have the energy not to cry. And I told my son, I don't think I can keep living like this. And I was just thinking, if every time I shower, if it keeps getting worse like this, I just don't know how long I can live. And I wasn't planning anything. I wasn't suicidal, but my son, he was really concerned. He called my daughter. The whole family went into powwow. And then I was trying to calm them down, and I wasn't feeling well. And I was like, okay, I can't take this anymore. My family can't take this anymore. I can't shower anymore. And December 5th was the last time I showered until about 2 weeks ago.
Wow.
And it's been, I cut my hair so that there's less hair to shower, less hair to wash. And it's all been sink baths and washing my hair in the sink. And even then, even doing that would knock me flat. Not as flat as showering, but it got less. Over several months, it gradually got better to where about a month and a half ago, I can wash my hair in the sink and I no longer crash the next day. I don't, the crashing involves passing out. So I would sit down on the couch and I would just pass out where I was. I would just fall over.
Which has its own dangers.
Right,
I'm sure
right.
Your son being very concerned for you also in your physical health.
Yeah. So, yeah. But I got to the point where I quit crashing after, 5-6 months of not showering. So I tried again a couple weeks ago, and I did crash the next day, but I only crashed for 8 hours, which is a lot better than a few days. But I'm still going. So that was the big thing for me. Was that December 5th was, I can't do this.
And so since the beginning of the pandemic, since the beginning of your illness, and then carrying through to some degree, you spent your time and your energy bringing awareness and advocating, more or less for this, for COVID-19, but then also now this experience as a long hauler and with long COVID. So I wanted to, I was hoping maybe to spend these remaining minutes, if you'd like to speak to, the ways through which you do share your story, and, through your living stories, and just how you do advocate for this chronic illness.
I do a lot of work for my job in social media, and I have a fairly substantial Twitter following, and less of a following, but a more engaged following on Facebook. And Facebook allows more of the longer posts. So lots of times my blog posts would actually first come from Facebook. I would post there and people would ask me a lot of questions, and I would answer the questions, and then I would take the post and copy and paste it into my blog and add in a little bit to answer some of the questions people asked. On Twitter, you can change your show name without changing your Twitter handle. So I changed, instead of my handle is PF Anderson. And before, my show name was PF space Anderson. And now it's PF Anderson is recovering slowly, ... And people would go, what do you mean is recovering slowly? Recovering from what? Did you get COVID? And yes, I did. I also have a thread on COVID going where I just keep adding. I use the longcovid hashtag, and I have a thread where I keep adding long COVID stories and long COVID research. And I made a list on Twitter of a lot of the people who are doing a lot of talking. So on Twitter, you can make lists of accounts of people on a theme. And I made one for long COVID, and it is right now, of all of the lists that I've ever made, it has the most followers by multiple times. I wouldn't call it viral, but for me, it's a lot of people paying attention to my Twitter list. So I have in my Twitter thread on long COVID, I'm up around 350 articles.
Wow, substantial.
I keep the running count. Yeah, and there's so many more that I can only post so many because I'm doing most of this outside of work time. And when I'm outside of work, lots of times I'm resting or trying to recover. So I'm doing this on personal time, and I can't keep up. There's so much more that I have in my notes that I want to add, but I can't keep it going as much as I would like. There's so much more I would like to share.
Yeah. Well, we'll be sure to include these links for folks who would like to check out the resources that you've put together, and the continuously growing library of information that you're continuing to put out there and to help inform other people on their journey as well. So thank you so much, Patricia, for taking the time to speak with us and to share your story.
Thank you, Shannon.